Alright, how's it going? Today we're talking about a very serious problem, which is RI or respiratory infection in your snakes and how to treat it. It can be a very serious problem if it's untreated. It can lead to killing your snakes. So we picked up a new snake on the weekend that has some suspected symptoms for RI. So we're not going to take any chances. We're going to treat it for it before we put it with the rest of our snakes. And we're going to show you how to deal with that problem in case you ever have to. Now, first things first is we keep the snake quarantined. You should do this with any snake that you get that's brand new before you add it to the rest, because if there are any problems, you don't want to introduce those problems to all your other snakes. So down here we have our quarantine set up. So it's kept in a room that's well away from any of our other animals, and it's just a very basic setup. It has, a log and a box for it to hide in and amongst, but it doesn't. We want to keep it all perfectly clean, so we don't want too many items, just enough for it to get to its heat and away from its heat, and of course some water. Now, up on the wood a bit. This is Onyx. I have a new black-headed python. Yeah, very, very calm, well-natured snake. Very lovely snake. Normally, I'll probably, if there was any signs of, you should always check before you buy your snakes, which we did. We looked at this snake and it looked great. Didn't show any signs, but once we brought it home, it had a little bit of wheeziness, and it did appear to have maybe a bit of mucus in the mouth and nostrils. It was having a good drink of water when we picked it up, so possibly just residual water coming out. I'm not sure, because we haven't seen any mucus since. And it's been, I know he's had about 5 shots of his antibiotics so far. So this is him. Now, when you're treating snakes with RI, it's imperative that you get it treated as soon as possible. Time is of the essence for your snake. If you wait, it's going to get worse and worse. Okay? Because they're ectothermic animals, a common cold for them is a death trap. It's not something that they can shake. Because we can regulate our body temperature, we can shake a cold virus quite easily. But reptiles can't do that. So they need treatment. They need antibiotics. Yeah. I'm just listening now. Oh, did he try and bite? He just freaked out. Just listening for any signs of wheeziness. If a snake is really sick, you'll feel it all along their body. Like when you've got a rumbly tummy and you feel it all along, and he hasn't had anything like that, so I could tell it was only very early stage. Apparently the people we got it off had kept him in a bird aviary over the summer, which is probably fine out where they are in Brisbane. And it just come change of season, just after we got him, it had just come into autumn, so I think they just left it a little too late to bring him inside, and he's picked up some little virus, but it's more than treatable. So we'll take him out there and we'll show you how to actually get rid of this horrible virus. Okay, so these are the antibiotics. This is Batrol. Haven't used this before. We've used Enrotrol in the past, and one that starts with C that I can never pronounce. Katie is a nurse, so she's better at this medical mumbo jumbo than I am. So what do we have to do first, babe?
Wash our hands.
Wash your hands. Makes sense, I suppose. And why is this thing in this black nonsense?
Because that type of medicine is required to be kept in the dark at room temperature.
Oh. And other antibiotics you might have to keep in the freezer or the fridge, but this stuff has to be kept in the dark. The amount you'll need will depend on the weight of your snake, so you're going to have to get it weighed at the vet, and then depending on the antibiotics you're using, you'll have a different amount. So for this snake, what do we need, babe? Half a mil, is it?
Yeah.
Half a mil for a 5 kilo snake. So there you go. That's the ratio, 4.9 kilos to be precise.
when you're drawing up medication, if you're drawing up to 0.5 of a mil, pull it just a smidgen under. And then try to get it in the hole.
Sometimes you'll get a vial to do it from instead of a syringe.
Recapping a needle, put the cap into the needle first so you don't get a needle stick injury.
Which I did once before.
The good news is there's no snake aids.
Yeah, even the guy at the hospital learned that night.
So you want to make sure that there's no air bubbles because you don't want to inject air into your snake or your patient if you're doing that at the hospital for a person. Okay. Ready to administer. Now we need the snake.
Alright. Now, depending on your snake, they can obviously be a bit jumpy when they get needles. He's taken it well so far. This is what, number 6 for him. So with these antibiotics, he's had to have it every 2 days. And what you want to do, come in, Jack. Make sure we get some nice close shots. You want to be in the back half of the snake and inject it in the top half of the body, underneath the scale. It can either go under the skin or into the muscle. So, you need to hold this snake as still as we can. I know, mate, I know. Okay. So you need to go under the scale, not through. And if you can see where it's slightly bubbled up, that's okay. That means it's gone under the skin and not into the muscle, or a half cut as the vet would call it. You see? Because it's still going to absorb the antibiotics, but it's not going to hurt as much going into its muscle as it would going into its muscle. So yeah, taking it well. And of course, we've put the head underneath the pillow, just in case you've got a snake that likes to swing around at the time, but he hasn't once yet. It's a pretty big snake, can take it pretty well. One last thing we're going to do is wipe down these lounges with some antibacterial, because it is a communal area, but we thought we'd do it out here because there's better lighting and more space. But you probably should try and keep your snake in the same room and just do it in the same room as the enclosure is in. But this guy's nearly better now, so we thought we'd bring it out here and show you. You can hear a bit of wheeziness still, huh?
I think he's hissing at you.
He's hissing because he's cranky about that. But anyway, we'll go put him back now, because as much as we're keen to play with him until he's better, he'll stay in the enclosure.
What's down your pants, babe?
Well, everyone knows there's a snake in my pants. An anaconda. More like a blind snake, but... So yeah, good practice would be to just bring him out to the enclosure, put him on a cloth here and on a blanket and do it all here so it's contained into one spot. But yeah, for the sake of getting a bit of a better video, better lighting, we did it out there. He's nearly through the course of antibiotics. It's a month, every 2 days to a month he needs that, and then he can go into a bigger enclosure that's properly set up. But for now it's just important that he stays clean, stays away from any of the other snakes. But yeah, that is how you treat it. It's not a nice thing to have to do, but if you have a snake that needs it, it's important you get onto it straight away and get it done. It will make the difference between your snake's life, or at least quality of life, because the RI can come back. You can think it's gone, and then it can come back years later if you don't treat it properly. So yeah, hope you've learned something and hope you enjoyed that one. catch you on the flip side.